Welcome to the deep dive.
Glad to be here.
Today, we're really plunging into something quite challenging in vet med, pulmonary thromboembolism, PTE for short.
Right, in dogs and cats. It's one of those conditions that's often on the list, but actually nailing the diagnosis, that's tough.
Definitely. And it has huge implications.
Yeah.
So for this deep dive, our guide is, well, it's pretty dense material excerpts from a veterinary text, pulmonary thromboembolism, veterinary diagnosis and treatment.
A solid source.
Yeah, and our mission today is just to pull out the absolute core stuff from these pages. What is PTE? Why is it so hard to spot? What kicks it off? And how do vets manage it? We want you to walk away with the critical insights.
And right off the bat, the source makes a really key point. This usually isn't something that just pops up on its own. Understanding PTE really means understanding how it connects deeply to other diseases happening in the animal's body. It's often a complication.
Okay, let's unpack this then, starting basic.
Mm-hmm.
What exactly is pulmonary thromboembolism?
So at its heart, it's when a thrombus, basically a blood clot, travels and gets stuck in the pulmonary arteries inside the lungs.
Okay.
And that blockage stops blood flow to a part of the lung tissue.
And these clots, what do they actually form? Do they just sort of appear in the lungs?
That's a great question, and the source says the origin, often not totally clear. But usually these clots, these thrombi, they form somewhere else in the body first.
Like where?
Potential spots are veins, like the big vena cava, the jugular vein in the neck, femoral in the leg, even mesenteric veins in the abdomen, or sometimes the right atrium of the heart. They form there, break loose, and travel as emboli to the lungs.
So they're mostly travelers, little clots on a journey.
Most of the time, yeah. But there's a big exception, the source points out.
Which is?
Heartworm disease. In that specific case, it's different. The thrombi can actually form in situ.
Meaning right there, in the lung vessels.
Exactly. Right there in the pulmonary vessels themselves. Probably because of all the damage and inflammation the heartworms cause.
Got it. Okay, so traveling clots usually, but sometimes forming right there with heartworm. What makes an animal likely to form these clots in the first place? What predisposes them?
Well, the source lays out the classic predisposing factors. It's usually not just one thing, but sort of a perfect storm.
Okay.
You've got abnormal blood flow, think sluggish flow or stasis. Then there's damage to the inner lining of the blood vessels, the endothelium.
Right.
And crucially, there's some change in the blood itself that makes it more prone to clotting. And altered coagulability, often what we call a hypercoagulable state, blood's just too sticky.
So those three things kind of work together. Bad flow, vessel damage, sticky blood. And the source really hammers home one point about this, doesn't it?
It absolutely does, and this is probably the most vital thing for vets thinking about this. In most animals, PTE isn't the main illness.
It's a consequence.
Exactly. It's a complicating feature, a serious complication stemming from some other underlying disease that's creating those clot-forming conditions.
That totally changes how you'd approach a case, I imagine. So when a clot does block that blood flow in the lungs, what systems take the hit?
Primarily two big ones. Cardiovascular and respiratory.
Okay.
On the heart side, blocking blood flow into the lungs jacks up the pressure in those pulmonary arteries. That's pulmonary hypertension.
Right.
And that puts a massive strain on the right side of the heart. You can get right ventricular enlargement, problems pumping, basically reduced cardiac output.
And the breathing part?
Well, if blood can't get to a section of lung, that section can't do its job, right?
Yeah.
Can't exchange oxygen properly.
Makes sense.
So that leads to low oxygen in the blood, arterial hypoxemia, and clinically what you see is dyspnea, difficulty breathing.
Do we actually know how often this happens? Is it common? Rare?
That's where things get fuzzy. The source points out a big challenge. The real incidence, how often it actually occurs in dogs and cats, we don't know precisely. We know it's way more likely if an animal already has clotting problems or some severe systemic disease. But here's the kicker, and it's frustrating.
Okay.
It's generally considered an uncommon diagnosis.
Okay, uncommon diagnosis.
Yeah.
But the source implies that might not be the whole story.
Exactly. The text strongly suggests it's probably underdiagnosed. A lot.
Right.
Well, think about it. The signs are super nonspecific. Sudden breathing trouble could be loads of things.
Right.
So vets might not immediately suspect PTE, and maybe the biggest hurdle, there just aren't many, if any, really good non-invasive tests you can run quickly to say, yes, definitively, this is PTE.
You can't just do a quick blood test or a standard x-ray and know for sure.
Pretty much. Not for a definite answer.
That explains a lot of the challenge.
Yeah.
So who should make you suspicious? Any particular breeds, ages?
The source mentions both dogs and cats, of course. In dogs, it tends to hit middle-aged to older animals more often.
Okay.
Cats are interesting. They have this sort of bimodal thing going on. A peak in young cats under 4 years old, and then another peak in older cats over 10.
Huh. Weird. And those nonspecific signs you mentioned, what does the owner typically report?
Often the history they give just sounds like the underlying disease, whatever that might be. But if the PTE itself is the acute crisis bringing them in, the signs can be sudden and really severe.
Like really dramatic onset.
Yeah, exactly. Think peracute dyspnea, sudden, can't catch their breath kind of distress.
Wow.
Also not eating, sudden collapse or fainting syncope, maybe coughing, sometimes even coughing up blood, which is hemoptysis.
Scary.
Or just weakness, can't exercise, or being really restless, like they just cannot get comfortable. That's on the list too.
And when the vet examines them, what might they find?
Most will be breathing fast and hard, tachypnea and dyspnea. Listening to the chest, you might hear abnormal lung sounds, crackles or wheezes sometimes.
Right.
And in really severe cases, you see signs that the heart and circulation are struggling. Fast heart rate, weak pulses, maybe the jugular veins in the neck look distended.
Signs of shock almost.
Getting there, yeah. Pale or even bluish gums, cyanosis. Slow capillary refill time. And sometimes, listening to the heart, you might pick up a new murmur or weird heart sounds, suggesting that right-sided strain we talked about, like a split or loud second heart sound.
It really paints a picture of an animal in serious trouble. Okay, let's circle back to that critical point, PTE being a complication. The source gives a specific list of diseases or conditions often linked to PTE. This seems super important for raising suspicion. What's on that list?
This list is gold, really, for spotting animals at risk. The text lays it out clearly. First up, heartworm disease, which we mentioned.
Right.
Then neoplasia cancer, hypercoagulable, Cushing's disease, or even just being on long-term corticosteroids like prednisone.
Okay, commie stuff.
Very. Then conditions where the body loses protein, either through the kidneys protein losing nephropathy or the gut protein losing enteropathy. The source flags these because you can lose natural anticoagulants, like antithrombin, making clots more likely.
Ah, that makes sense. What else?
Immune-mediated hemolytic anemia, IMHA, another big one. Pancreatitis is on there. Pre-existing pulmonary hypertension itself is a risk factor.
That's already quite a list of serious problems.
And it keeps going. Orthopedic trauma or major surgery. Sepsis, widespread infection. DIC, or disseminated intravascular coagulopathy.
That's the really bad clotting chaos one, right?
Exactly, where you get clotting and bleeding all at once. And finally, liver disease.
Wow. I mean, and that list covers a huge chunk of the really sick patients vets see. Looking at it, the common denominator seems to be things that mess with blood clotting, right?
Absolutely. That's the thread connecting them. These diseases often create those risk factors we talked about, especially that hypercoagulable state. Blood just wants to clot. Recognizing these conditions is step one to even thinking, could this be PTE?
The source also mentioned a couple of things noted in humans.
Right, and it's careful to say these are noted for humans.
Yeah.
Giving estrogen and air travel just mentions them as human risk factors, doesn't really apply them to pets in the text.
Okay, good clarification. So we know what it is, the signs, the risk factors. Now let's really dive into that diagnostic challenge. You said nonspecific signs, lack of easy tests. What else makes it so hard to nail down?
Well, a big part is just ruling out everything else that could cause similar signs, especially sudden breathing problems where the chest x-rays don't look too bad initially. That's your differential diagnosis list.
So what are the main mimics you need to rule out?
The source lists things like, say, an upper airway obstruction, though usually that sounds different. More noisy breathing on the way in, often loud sounds over the throat.
Like laryngeal paralysis?
Laryngeal paralysis, yeah. Or maybe some diffuse airway diseases like inhaling a toxin or certain kinds of interstitial lung disease that don't show up dramatically on x-ray right away.
So with all these possibilities, how do you push PTE higher up that list? When should it be a top suspect?
The text gives really crucial advice here. It says PTE should be a primary differential, like high on your list whenever you see a patient with that sudden onset of severe dyspnea or collapse, especially if that animal already has one of those known associated diseases we just listed.
Ah, the context is everything.
That context is key. Knowing the animal has, say, Cushing's or IMHA, and then suddenly collapses, gasping for breath, PTE needs to jump way up your list of possibilities.
That link feels critical for getting on the right track.
Okay, so let's say you do have that high suspicion. What tests does the source recommend, starting with lab work?
Right. So your basic blood work, CBC, chemistry panel, urinalysis, you'll likely run them, but they often just reflect whatever underlying disease is going on.
Not specific for PTE itself.
Not usually. The CBC might give a hint it can be normal, but the source notes up to half of dogs with PTE might have low platelets, thrombocytopenia, maybe a high white count. Urinalysis is mostly useful to check for protein loss, pointing towards that kidney disease risk factor.
What about checking oxygen levels directly? Blood gases. Arterial blood gases are called crucial in the source, absolutely essential to see how low the oxygen really is. The PO2 is often under 65 mmHg.
And what else do they show?
Typically early on, the animal's hyperventilating, blowing off CO2 so the PeCO2 is low, leading to what's called respiratory alkalosis. But if they get really severe, decompensate, acidosis can develop later.
Now, D-dimers. We hear about them all the time for clots in people. What's the verdict from this source for pets?
This is a really important point the source makes, and it's different from human medicine. D-dimers do indicate clot breakdown is happening somewhere.
Right.
But their actual usefulness for diagnosing PTE in dogs and cats, the source describes it as uncertain.
Uncertain.
Yeah. Levels can be elevated, but not always, not consistently. And here's the really critical bit. The source states clearly that a low D-dimer level does not rule out PTE.
Wow. Okay. That's huge. So it's not the reliable rule-out test it can be in people.
Exactly. Very important takeaway. The text also mentions thromboelastography, TEG, which looks at overall clotting function. Could be useful for spotting hypercoagulability, but it's not available everywhere.
And a standard coag panel, PT, PTT.
Might show some abnormalities like high fibrin degradation products or changes in PT-PTT, but again, not specific enough to diagnose PTE on their own.
And since heartworm is a known cause?
Testing is mandatory according to the source, non-negotiable. You must run a heartworm serology antigen test in dogs, antigen and antibody in cats if you suspect PTE.
Okay. Any other blood tests?
Cardiac biomarkers might be elevated, things like cardiac troponin I or NT-proBNP. They suggest the heart is under strain, but again, not specific just for PTE.
So lab tests provide clues, maybe support suspicion, but don't clinch the diagnosis. What about imaging? Where do you usually start?
Chest x-rays, thoracic radiographs are the standard first step, but the source really emphasizes the findings are variable. They could even look totally normal.
Really? Normal x-rays?
Can happen. Or you might see subtle things. Changes in the pulmonary arteries, maybe the heart looks enlarged, weird lung patterns, diffuse hazy stuff, sometimes a little bit of fluid around the lungs, pleural effusion, or maybe those weirdly dark areas, regional hyperlucency, the Westermark sign where there's no blood flow. But it's inconsistent.
What about an echocardiogram, an ultrasound of the heart?
Echo can be very helpful. It can show evidence suggesting pulmonary hypertension is present.
Oh.
Things like the right ventricle looking thick or dilated, the wall between the ventricle septum looking flattened, the left ventricle seeming small because the right side is pushing on it, or measuring high speeds of blood leaking backward through valves, which indicates high pressure.
So indirect signs. Can it actually see the clot?
That's the catch. The source notes that actually visualizing the thrombus itself, like in the right heart or the main pulmonary artery, that's infrequent with just echo. You might get lucky, but usually not.
Okay, so basic imaging, basic labs, often not enough for a definite answer. What is the source that you need for certainty?
Yeah, this is where it gets serious. The source is pretty clear. Getting a definitive diagnosis usually requires advanced imaging. You typically need one or more of these: CT scan, angiography, or radionuclide studies.
And which one is considered the best?
CT angiography, explicitly called the gold standard in the source.
What?
Because it can directly show the clots as filling defects inside the blood vessels, or it might show other related signs like those wedge-shaped areas in the lung periphery or pleural effusion. It gives the clearest picture.
What about the other advanced options?
Well, there's right-sided cardiac catheterization where they thread a catheter up and inject dye for angiography. It can identify clots or areas with no blood flow, but the source cautions that standard radiographic angiography, its success rate isn't that great compared to CT.
Okay.
And then there are ventilation perfusion scans, VQ scans. They use radioactive isotopes to see which parts of the lung are getting air, ventilation, versus which parts are getting blood flow, perfusion. A mismatch good air, bad blood flow points towards PTE.
Any other diagnostic procedures mentioned?
An ECG, electrocardiogram. It won't diagnose PTE itself, but it might show signs the right heart is under strain, what's called acute cor pulmonale. Things like shifts in the electrical axis, changes in certain waves like the P wave or ST segment, or maybe arrhythmias. Helpful clues, but not diagnostic alone.
Man, it's clear getting that definitive diagnosis is a big deal, often needing specialized gear. If you could look inside, say, after an animal passes, what would pathology show?
Yeah, postmortem exams typically find the clots, the thrombi, lodged in the main pulmonary artery branches. The source also mentions sometimes it's not one big clot, but tons of tiny ones in the small vessels, which can still cause massive dysfunction.
And you'd see the underlying disease, too.
Almost always. Consistent with PTE being secondary, it's very common to find other lung problems at the same time, maybe pneumonia, edema, cancer, scarring, fibrosis alongside the clots.
Okay, let's shift to treatment. You've got a diagnosis or at least a very strong suspicion. What's the approach based on this source? Where do you start?
First off, level of care. Generally, these animals need to be hospitalized, inpatient care, until that low oxygen level, the hypoxemia, gets better.
Makes sense. And basic supportive care. 5E fluids. Oxygen.
Oxygen therapy is definitely indicated if they're dysmaic or hypoxemic. Though the source notes the response can be variable, might not fix everything. Fluids. You have to be really careful.
Why is that?
Unless they're clearly dehydrated, the source warns against aggressive IV fluids. Giving too much fluid increases the blood volume the already struggling right heart has to pump against those high pressures in the lungs. You could actually push them into right-sided heart failure.
Ah, okay. Good point. Now, what's the absolute most critical part of treatment, according to this text?
This comes up again and again, and it's probably the second most vital takeaway after knowing it's a complication. You have to identify and treat the underlying primary disease.
The root cause.
Exactly. The source is blunt about it. Trying aggressive PTE treatments without tackling the underlying cause. Likely pointless. Futile is the word used. You've got to fix what started the problem.
Makes perfect sense. So, while you're working on that underlying cause, what about medications specifically for the clots? Anticoagulants.
Yes, antithrombotic drugs are key. Their main goal is usually to prevent more clots from forming. Unfractionated heparin is one option.
How was given?
The source mentions dosages for either subcutaneous injection every 8 hours or an initial IV bolus, followed by a continuous IV drip, a CRI.
And you monitor it.
Yeah, you monitor the PTT, a clotting time, aiming to keep it about 1.5 to 2 times the normal baseline. And there's a warning, using low prophylactic doses is probably not enough for the initial treatment phase. You need therapeutic levels.
What about drugs to actually break down the clots that are already there? Clot busters.
Right, thrombolytics, like urokinase, streptokinase, or TPA. These can be considered, the source says, but mainly in really unstable patients whose circulation is severely compromised.
But there are downsides.
Big ones. They're expensive, and they carry a much higher risk of causing serious bleeding, so reserved for critical situations.
Okay, what about once the animal is more stable?
Uh-huh.
For longer-term prevention?
Warfarin is mentioned as an option for chronic long-term treatment, an oral medication.
How does that work?
Source gives a starting dose example and says you monitor a different clotting time, the PT, aiming for that same 1.5 to 2 times baseline range. But here's a crucial point they make.
Yeah.
You must start the animal on heparin first, before or overlapping with starting warfarin.
Why that?
Because of how warfarin works, it can actually make things slightly more clotty right at the very beginning before the full anticoagulant effect kicks in. Heparin covers that risky initial period.
Good to know. Any other warnings about warfarin?
Yeah, lots of potential drug interactions. Diet can affect it, and figuring out the right dose can be tricky, especially if the animal already has some underlying clotting issues. Needs careful management.
Are there other options besides heparin and warfarin? What about low molecular weight heparins?
Yes, LMWHs are discussed, things like dalteparin or enoxaparin.
What are the pros and cons there?
The main advantage mentioned is they likely cause fewer bleeding complications than unfractionated heparin or warfarin. They also need less intensive monitoring, which makes them better suited for potentially long-term use, maybe even outpatient.
Sound good. The catch?
Expense. The source notes they are significantly more expensive. It does give specific dosages used for dalteparin and enoxaparin.
Any other specific drugs mentioned that aren't directly anticoagulants?
If sildenafil is mentioned, Viagra.
Right. Why that?
It can help relax the blood vessels in the lungs, so it might be beneficial in selected cases if the animal also has that pulmonary hypertension we talked about. A dosage range is provided.
Okay. And with all these powerful drugs, The source gives one last piece of general advice.
Yes, it strongly advises vets to really review the mechanism of action, the pharmacology, how these antithrombotic drugs work before using them. They're not drugs to use lightly.
Definitely sounds like it. So after the initial crisis, what does follow-up look like? And prevention?
For monitoring, you'd keep track of breathing and oxygenation with serial blood gases or pulse oximetry. If they're on warfarin, that PT monitoring is intense initially, like every 3 days while adjusting the dose. Then maybe weekly once stable, which the source notes can take 2 weeks or more.
And they recommend using INR.
Yeah, using the INR International Normalized Ratio for the PT results is recommended to help make results more consistent between different labs.
Okay. And preventing future clots. What can be done?
Well, simple things first. For animals laid up by illness, just activity, physical therapy can help venous blood flow and potentially prevent clots. Then there are antiplatelet drugs.
Like aspirin.
Aspirin is mentioned at a low dose. It may have a preventive role, the source says, but it's very clear. Aspirin is not strong enough for treating active PTE, inadequate for treatment.
What else?
Clopidogrel, another antiplatelet, is listed as an alternative. Sometimes a loading dose is used to get it working faster.
Can you use the stronger anticoagulants just for prevention in high-risk animals?
Yes. The source mentions using heparin, maybe IV first, then subcutaneous every 8 hours for thromboprophylaxis, or dalteparin, the LMWH, given every 12 hours, is also listed as a preventative option.
Does the source mention any of the newer oral drugs people take now, like Xarelto or Eliquis?
It does briefly touch on them, rivaroxaban, apixaban, dabigatran. It notes they're effective for prevention in humans and might have a future role in pets for long-term use.
Okay.
But it stresses that, according to the source, we definitely need more research on the right doses and safety in dogs and cats before they become mainstream.
Got it. Now, with all this talk of anticoagulants for treatment and prevention, what's the biggest risk? The main complication to worry about?
Bleeding, hands down. The source is very direct. The most significant complication of the treatment itself is clinically important bleeding caused by these drugs.
Where can that happen?
Anywhere, really, any organ system. So you have to anticipate it, watch for signs of bleeding or anemia, and be ready. Have blood products, plasma, or whole blood potentially on hand for transfusions if needed.
Okay, so PTE is complex, tough to diagnose, treatment is tricky, and has risks. What's the bottom line? What's the expected outcome, the prognosis?
Overall, the source describes it as generally guarded to poor.
Not great.
Not great. And again, it all comes back to that underlying cause. The prognosis critically depends on whether you can successfully identify and resolve whatever triggered the PTE in the first place.
So if the underlying disease is, say, an aggressive cancer or really advanced kidney disease,
Then the long-term prognosis is poor because you can't fix the root problem. It's somewhat better, the source suggests, if the PTE was triggered by something potentially temporary or fixable like trauma or maybe sepsis that you can get under control.
is sudden death a real possibility?
Unfortunately, yes. The source includes a sobering reminder that sudden death is not unusual in these patients.
Wow. Okay, this deep dive, using this veterinary text as our map, has really highlighted just how complicated pulmonary thromboembolism is.
Definitely. From understanding how these hidden clots form, where they come from, that huge list of diseases that put animals at risk.
And just how incredibly challenging the diagnosis can be.
Yeah, initial tests might raise a flag, but getting that confirmation often needs advanced imaging that just isn't available everywhere, right?
Right, and it really hammers home that just treating the clot itself isn't the whole game. You absolutely have to go after that underlying disease.
That's the core strategy, isn't it? The source makes it clear, without fixing the root cause, even aggressive PTE treatment probably won't work long term. And the treatments themselves, well, they carry that big risk of bleeding.
And the prognosis is just so tied to fixing that primary problem, which, as we saw from that list, isn't always possible. So here's something to chew on, thinking about everything this sources lay out for us. Given how hard it is to definitively diagnose PTE without those advanced scans, and how uncertain some common tests like G-dimers are in pets, unlike in humans, and knowing how much the outcome depends on finding and fixing that other disease, does this make you reconsider maybe how high PTE should be on your list, or how aggressively you pursue looking for those underlying causes the next time you're faced with a dog or cat that suddenly crashes with unexplained severe breathing problems or collapse, even if the initial clues seem a bit vague?